super excited to chat with Meghan Baker today. Meghan is a chiropractor and she's here to chat with us about the ins and outs of chiropractic treatment. Meghan received her doctorate of chiropractic medicine and her master of sports medicine from the University of Western States in Portland, Oregon. Meghan has always had a passion for an integrated approach to health and wellness, and her goal is to provide patients with the treatment, tools, and support they need to feel healthy, strong, and empowered to do the things they love. Most importantly, she cares about using a collaborative and functional approach to tailor each patient's treatment plan, whether it's rehabbing an injury, balancing working out from home, or wellness and preventative care. Welcome, Meghan.
Hi, thank you so much for having me. I'm so happy to be here.
I know there's a lot of schooling and training involved in becoming a chiropractor. Tell us a little bit about that.
Chiropractic degree is actually a 4-year clinical doctoral program. So in addition to things like your basic sciences, organic chemistry, radiology, pathology, nutrition, diagnostics, and then obviously we spend close to, I think, 1,400 hours with clinical experience as well.
And what are some of the things that a chiropractor can help us with?
So chiropractors are really great in the sense that they do operate as a kind of general practitioner. Because we've got those diagnostic skills, we can really help you figure out anything from TMJ and jaw pain and headaches, chronic neck pain, headaches, ankle sprains, hip pain, low back pain. I think the most common things we tend to see are low back, neck, and shoulders. But a lot of the time, those issues, especially for us who are working at home or who have gone almost a year without care, those problems tend to kind of start to slowly manifest all over the body. So a year into the pandemic now, I am seeing everything from neck and shoulders to elbows, wrists, fingers, you name it, I've probably treated it.
Right, of course. Yes, we're all sitting a lot more than we used to. So you kind of brought me to my next point is who could benefit from treatment?
Think of chiropractic kind of in terms of 3 buckets, I guess, in terms of the types of patients that it can benefit. So one is kind of the obvious, the acute care. I, slipped and fell, sprained my ankle, or I was bending over to pick up my kid's Nerf ball and think I herniated a disc in my back or have chronic headaches, that type of thing. In which case it's, okay, come in, let's get you out of pain and almost rehab you back to before the specific injury.
Right.
The next bucket of care tends to be a little bit more I'm calling it kind of work from home syndrome. So not just people who work from home, but again, who haven't had care in a long time. And their bodies are just starting to feel it. So it's not that there is a super specific injury or an incident, but whether it's neck and shoulders, headaches, carpal tunnel syndrome, people are just kind of really feeling their bodies and need some overall care to kind of get them back to where they want to be. And then the third bucket is more of the maintenance and wellness type care. And this is where I would love to be able to get all of my patients to, where I think that everybody should have some type of body check-in once a month, whether it's with a chiropractor, an acupuncturist, massage therapist, but some type of check-in with your body just to make sure everything is moving well, feeling good. And if something's starting to creep up, you get to stay on top of it, as opposed to 4 months later thinking, oh, I've had these headaches every single day for a week, or I've had this hip pain and haven't been able to go for walks with my kids. Maybe now I should do something about it. So
Yeah, that makes a lot of sense. I think back to how I used to perceive chiropractic care, and I would kind of go if my neck went, my back went, and I would make an appointment and go in and have an adjustment or a treatment, and then I'd feel better, and that would be the end of that. And then I wouldn't think about it again until I had another issue. But since I started seeing you the last few months, I go every couple of weeks, and I feel like we're kind of building on that health and wellness piece. I move better now, and I'm more mindful of posture and things going on when I'm driving and sitting and cooking and
Exactly. And like you and I kind of noticed where it's very much the things start to maybe feel a little off, but with you, we're at the point now where there hasn't been any like fire alarms going off and we really got to like bring it back down. We just get to kind of keep you staying healthy as opposed to trying to put out fires.
That's it. Yeah, absolutely. And so, what is the difference between a physiotherapist and a chiropractor? Because I know a lot of people have that question, like, who do I go and see and for what?
I think that chiropractors are a really great entry into allied health, whether we're looking at physiotherapy, chiropractors, naturopaths, acupuncture, massage therapists. We do a combination of soft tissue and muscle work, joint mobilizations where needed, and then really focusing on giving you tools, exercises, stretches to help support yourself. Physiotherapy in Canada is a 2-year graduate program, so still a ton of knowledge, but not as much of those diagnosing skills and abilities. Start with a clinic or a chiropractor that you trust and feel is going to support you. And then that chiropractor can help you figure out who's going to be the best therapist for me in this journey.
Let's say they were struggling with a life threatening issue, cancer. You have the ability, based on your degree, to help kind of steer them in that direction to go and get maybe it's not necessarily a chiropractic issue. Maybe there's something else going on.
It's those, 1 in a million, hopefully type situations. But unfortunately, things like low back pain or chronic headaches or, some weakness in the arm, very rarely that can actually be a more serious cause, whether it is cancer or a case that I had a few weeks ago, a brain tumor. And while I am not personally, going to be the one treating that, I have the clinical diagnosing skills to recognize, hey, this isn't just regular low back pain, or this isn't just, headaches and a little bit of nausea from eating something that wasn't quite right. Something more serious is going on here. And for myself, at least in that specific incident, I'm going to really be a patient advocate. That's what I mean in terms of allied health is with our medical system, they just don't have the time and the capacity right now to necessarily take an hour with a patient to go over all of this. So that's where we can really help to steer health and get patients the care that they need.
Yeah, it's so important. People don't have time to go to, dozens of different doctors when they're feeling unwell. So if more and more physicians and functional doctors and wellness providers can help them figure out, what truly is going on, that would make their journey a lot easier to navigate. So hopefully that's the way of the future. But talk to me a little bit about the other treatments that you do. We talked a little bit about the ART, the myofascial release, the cupping, which I'm a fan of, Graston therapy. Walk us through some of that.
Yeah, so chiropractors are doctors of joints. However, muscles move joints and nerves innervate the muscles. So we tend to look at the whole body. People think going to the chiropractor is just, getting your neck or your back cracked. I tend to think of chiropractic adjustments as a tool that I am very good at doing, but it's just that it's a tool. So my goal is to help people move in a way that's going to help them and stabilize if stability is actually what they need. And there's more than one way to do that. So yes, chiropractic adjustments, very satisfying, not going to lie. But also there's so many other ways that we can help you. So cupping is a way that I really like to get tissues, muscles, even sometimes like trapped nerves, get a little release there. IASTM or Graston technique is pretty intense, but it's a way of kind of stimulating muscles and the fascia to get things to, if they're stuck together like Velcro, we're just going to help them slide and glide and move in a healthy way. Doing ART and myofascial release, which is some really intense and muscle specific, movement specific manual therapy work. And then, like I said, doing supported rehab and exercise. So if my job is to help you move better, I wouldn't be doing my job if I didn't also give you some tools to be able to keep those changes.
Right. Yeah. The homework.
Exactly. Yeah. Always got to give homework.
And how often should someone come and see you or see a chiropractor?
That I believe is going to be patient specific. I tend to give people kind of two options. This is what I would ideally like, and then this is what life is going to allow. So how do we make this work for you? And that being said, if people aren't able to come in as often, that's okay. That's what life is, especially right now. However, they do have to do a bit more of that homework and just understand it's going to take a little bit of time. I think it's more about consistency than it is about a specific number of treatments. It is. Right. I mean, I can't want you to get better more than you want to get better. You know, like I said, life happens. Yeah. And it's okay if you slip and fall, and I will be here for you to help you get back on track. But you have to want it just as much as I do.
So Meghan, let's talk about some chiropractic tools. What do you, I know you had me get a few over the last little bit. What are you recommending?
I have at home and literally just have it in my living room because I use it so often, is my foam roller. Mm-hmm. I love this one. I've had it for, I think, almost 10 years now. These ones are a little bit more expensive. They're the Trigger Point Performance ones. However, if you're not sure if you want to spend whatever, these are like $40, $50 maybe, you can start with just, the $10, $15 ones from Winners, London Drugs, just to try it out. And if you like it, then you can invest in the more expensive one. The other thing I have most patients get is a lacrosse ball. You can buy these, same thing, Winners, London Drugs. We sell them at our clinic, I think, for $4. And this is same thing. I can put it pretty much anywhere and check in with how are things feeling. The third piece that I really, really like, and I would have just about everybody in the world have these if I could, would be some type of theraband. So I've got a big, long, open loop one here that I really like for things like rows and a lot of arm-based work. And then I also have a closed loop one that I use for things like glute bridges, monster walks, a lot of kind of lower extremity work, even for working the back.
The one contraption you had me get is for hands. So you put through here, your thumb, and this really helps because I often get a bit of carpal tunnel, a bit of tension from texting and computers, and so I do this every night when I'm in watching a show. I just sit there.
Yeah, it's such a great way to build up grip strength without overexerting the forearms. And the one that you just held up, I love because you can do both the squeeze with the hand, but then you can also put your fingers in those little elastic bands. And if you spread the fingers out, you'll actually work the back of the forearm. That one, yeah.
So this is for the psoas. So explain. It hurts. This thing hurts. You have to kind of build up to it, but once you kind of start getting used to it, I didn't even know what the psoas was. So talk to us about psoas.
Psoas is a thick band of muscle that actually goes from the lower part of the spine, crosses over the pelvis, and attaches onto the hips. It's what we call one of the hip flexors. And this muscle is, for most people, always unhappy. Just because we spend so much time sitting, that muscle, it's just like if you broke your arm and your arm was in a sling, your biceps would get short and tight and unhappy. Same thing with that psoas. It just, having to sit so much, it just gets short and tight and unhappy.
It's great. All these tools, they're so helpful, and you can just throw on your TV show at night and do your stretches, do your foam roller, do your hand crunches and your psoas work and stretch, and we're all the better for it. Hydration, does that help our body, our muscles, our...
Absolutely, yes. Hydration is key, I mean, for everyday life, but in terms of preventing headaches, in terms of preventing muscle cramps, really helping with everything from blood flow and blood volume to, not having your skin feel quite so dried out.
Yeah, I think that's one thing we all could do better is more water consumption.
More water, less coffee. Yeah. That's my goal.
Yeah. Well, thank you so much, Meghan. Oh my gosh, as always, it's such a pleasure talking to you. I love everything you stand for, the holistic wellness piece. the functional medicine piece and helping people move and feel better. So thank you again.
My absolute pleasure. It's always so much fun talking to you and connecting with you. And thank you for so much for honestly for building this community just to help connect women and educate them and really just trying to help women make healthy choices for their body and feel empowered. It's amazing work that you do. Thank you.
Thank you.